Hello, my name's Dr. Morris,
And my name's Sally Hinder. I'm a health visitor in Farnborough.
and in this short video we're going to be talking about head injury. Head injuries are really relatively common, particularly in young children when they're just getting up and about and starting to move around the world. Fortunately, serious head injuries are really very rare. We will return towards the end of the video as to what sort of things to look out for to make sure it's not a serious head injury. But really our focus is going to be on the common minor head injuries that you come across in kind of everyday life really with your children. So we'll talk a bit about what you can expect, what's normal in a head injury, what you can do to treat some of the minor problems of a head injury and look after them following that, and then return to some of the serious things to watch out for and might need urgent attention. So what's normal and what's common? Well, when you have a head injury, there's often two bits to it. You might have a superficial injury, so they might get a bump, a swelling, a little cut. We can talk about how you manage that. They might get some symptoms of concussion, and so with concussion they can maybe feel that they're just getting a bit dizzy, get a bit grumpy, a bit sickness, but not actually vomiting particularly, some concentration difficulties, and that might last for a few days or in some cases longer. And then very rarely they could have a serious head injury and then they need to be checked out in the emergency department. So what is normal? So it might be that the nausea tips into them actually vomiting a couple of times, so actually throwing up. And we call an episode of vomit, it's got to be sort of more than 10 minutes apart before you count it as 2 episodes of vomiting. And if they have 2 episodes of vomiting, that's okay, we'll let them have that. If they're vomiting much more than that, that's a bit more concerning and they probably need to be checked out. They may well feel a bit drowsy following a head injury, and their concentration might be decreased, and they might be off their food, a bit less appetite. But usually what you're going to expect is you're going to see a child that immediately is upset, cries out straight away, doesn't lose consciousness, no blackout, and you know exactly what's happened. And it's the usual things, maybe in the playground, banging into a bit of the play equipment, tripping on something, those sorts of things. So Sally, if we move over to you, how you'd manage those sorts of minor head injuries and the things that parents and carers can do.
So, as Ollie has said, in general, if child cries immediately, they don't lose any consciousness. You can probably, and as assuming that they're kind of returning to their normal selves, you can probably keep them at home, keep an eye on them, check that they're responding normally to you. You can do this regularly. There's not any prescribed time. You don't have to check on them hourly. If you are concerned, or you think that your child has been particularly drowsy during the day after the head injury, then it is okay to check quite regularly. But if they've been returned to themselves quite quickly, they've eaten, generally they've been okay, it's all right just to check on them kind of as and when you want to. You don't have to keep waking them up or anything like that. And then in terms of immediately after the head injury, it depends on what the injury looks like. If there is a bit of a cut, then you will want to put a compress on the cut and just try and keep some pressure on it for about 5 to 10 minutes, just to try and make sure that the bleeding stops. And depending on how big the cut is, if it's particularly wide, or if the bleeding doesn't stop, then you may need to access further help for the wound to be closed by a health professional. Generally, your child's probably going to need to rest for a couple of days, maybe after a head injury. Try and avoid strenuous activities, and you probably will want to try and avoid computer gaming or anything like that for a couple of days as well, just to make sure that they're not straining their eyes too much. If they are experiencing pain, then you can give paracetamol and ibuprofen. And if they have been concussed, if they have experienced a more serious head injury, then they may well need to have a bit of a graded return to school and to physical activities. And that will probably be at the agreement of the school. You can talk to them, or nursery, have a word with them and just say that they're going to need a little bit more rest and less physical activity for a few days afterwards, depending on what the doctor says. Okay. Ollie, can you talk about what some of the red flags are and when we'd want to access further help?
There might be some occasions, as I said, they're really very rare, when you realise that this is a much more significant injury. And really the best place for the child then is in the emergency department, where they can have the full assessment, and doctors consider whether they might need any other tests that you can only really get there. And there are various things that might make you do that. So some, it might be really obvious that you're in one of those horrible situations where it's clear there's been a really bad injury. So you've had a high-speed road traffic collision, or you've seen a child drop from a significant height. So a good kind of guidance would be, more than a metre or more than their own height landing on their head. There's a real chance of more serious injury there. If they've blacked out, particularly for more than 5 minutes, that's concerning. That suggests a significant blow to the head, and they definitely need to be checked out in the emergency department and monitored a bit more closely. We talked earlier about vomiting, so if it maybe at the time it didn't look like a severe injury, but actually they're just vomiting again and again more than those 2 times, that can be a concerning sign. And then other things that would be quite obvious you're going to pick off, if they have a fit, they're actually seizing and fitting following the head injury. And sometimes you can get signs that there's a more significant injury, so bruising that you might get around the eyes or at the back behind the ear, or clear fluid, so this isn't snot, but other fluid coming out through the nose. Those things can be concerning, need to be checked out. And finally, anything that suggests that the brain inside is just not working properly, so your child is speaking in a strange way, is confused, they've got any kind of symptoms that the body's not working properly, so they've got weakness on one side, they're unbalanced, they're not able to walk normally, having problems with vision, double vision, things like that. They're all pretty obvious things, and you're going to know this isn't right, they need to go and see someone. And in that case, the best place to go is straight to the emergency department, where they can do the full assessment that might be needed. You may find that you're in one of those grey areas, so you're not entirely sure that this is a truly minor one, but it's not clearly this child needs to go straight there and need to call an ambulance. In that case, it's absolutely fine. Of course, call your health professional, call 111, call your GP, and talk through things together, and they can decide the best place to assess your child. And in the same way, if it's more of a minor injury, but they've had some symptoms of concussion and they're dragging on and on, that's another good time to talk to your GP and say, well, look, this happened a few weeks ago and he's still not quite right. And they can come up with a plan of how to get things back to normal. The last thing to think about would be young children, young babies. So babies under 1, obviously everything's much more fragile. Careful there. If it's a very minor thing, and these things do happen, and we feel guilty about them, but it can happen. A sibling throws something across the room and it bounces on their head, or something drops off onto them. But the baby's obviously not really that bothered, and cry a lot straight away because they've had a shock, and they're okay following that. It's fine just to do the minor injury type advice and keep them at home, keep an eye on them. But anything more significant than that, I think it would be well worth talking with a healthcare professional just to check things are okay. So I think that's all we wanted to say about head injury. I hope you found that helpful. Do remember to look at the Health Together website. It's got all those really concerning features and what to do with them on the red, amber, green pathways, and it tells you some of the common advice about looking after the child, and also some advice about returning to normal activities like school and exercise and sports.